I am very excited that we get to talk today and that you're going to give us some background into your nursing history and the history of nursing in itself.
Okay.
I'd like to start off with, so tell me why you entered into nursing, and can you kind of give us a year?
A year. Well, I was a young person, probably before 10 years old, a child, and I always was interested in medical field and what made people tick and that kind of thing. So I thought about nursing, I thought about medicine, and when I got to college I thought about microbiology. We called it bacteriology in those days. It was before viruses.
Was that before viruses were even known?
Well, I think they might have been known, but nobody could see them, or there wasn't. We just learned about bacteria.
Okay.
So it was bacteriology at that time. But I thought about doing that as a science career. So it was anything in the science line that would have attracted me, and people particularly. I liked biology and chemistry and all the things that makes you understand how people are put together,
right,
and how things work. So why I ended into nursing, I guess nursing was always there for me as a possibility. I thought about medicine, but I had no money. And in those days there wasn't scholarship help available anyplace. New York State gave, I think, 2 or 3 scholarships to medical schools, to medical students in the state, a handful. And so it was not very easy to come by. So you had to be fairly well financed to go to medical school. So I wasn't, so I didn't. And then, I went to Elmira. Fortunately, I had Elmira College in my hometown.
So you grew up in Elmira, New York?
So I grew up in Elmira, New York. And they took some town students, so I was fortunate. I didn't have to live on campus. So I could walk to school and carry my lunch and finish college. So I majored in biology, minored in chemistry, and psychology and English. And I liked school. I didn't want to quit it. And I thought, well, what if I enter a career that I'm not happy with? I want to have some way to do something else. So that motivated me to finish my college. Several of my classmates did 2 years at Elmira College and then went on to nursing school in New York City, a Presbyterian hospital or New York hospital. But I chose not to do that. I chose to finish college. And then I had a very good advisor who knew about Yale University, which accepted only college graduates into their nursing program, and ended up with a master's degree. And so I thought, why not? So I borrowed a little money and I took myself off to Yale University. So it was a very wise decision because it was a very progressive, excellent school. A school in its own right, which Don Memorial Hospital was not at that time. So it was a real college of nursing. And it was.
So was it a four-year program?
It was a 3-year program. And so people have said to me, well, medical school is only 4 years. Why don't you go to medical school? Because it was really 4 years on top of college. And this was 3 years on top of college. But they don't seem to realize that there's much more to medical education than just the 4 years of medical school. There's all the internship and the residencies and specialized training. And so it goes on and on and on for those people. And this was 3 years, and then that was it. One of the options I could have had at that time, which I sort of regret I didn't, was to enter the military. Because I could have entered the military with a master's degree in nursing and then gotten financing to go on to school and see the world.
Become a doctor.
And I probably would have missed all the wars. I might have been in the Korean War, like the MASH units.
Right.
But I think my years fell that I would have just missed all the wars.
Now, were they taking women into the services at that time? Other than nurses?
Oh, yes. They took women into. They started taking women in the military during World War II.
They did.
They just didn't have the full rank and the full pay that the men did.
Oh.
They were lesser lights.
So they couldn't be a general or
no
a commander? Or,
no.
I guess I don't know all the levels.
Right.
Okay.
So, but I didn't do that. I got married instead. That was a period of time when, in the 50s, when people didn't live together. Unmarried people didn't live together. There was
Right.
none of that. You either married or you didn't marry. It was an either or. And so, and all my classmates were married, and that's what people did when they finished school.
Did you feel the need to do that also?
Yeah, I felt the need to get married. Yeah, definitely. I felt I'd be an old maid otherwise. So,
Did your parents think that that was important?
no, they didn't have any opinion one way or the other. I don't think they thought it was important. But I did marry, and so I went to Rochester.
So
and
you
had
and
my
your
first
husband
job with my husband, and had a first job there at Strong.
And what did you do with that position?
I was had to do a little stint as a floor nurse, staff nurse, which I did on a women's medical floor in Municipal Hospital, which was a county hospital, part of Strongmore Hospital. That was the days before Medicare and Medicaid, so communities took care of their own, more or less,
Right.
through county facilities, through taxpayers' money. And so Strong had a municipal side and then a private side.
So let's back up for a minute. So you had a bachelor's from Elmira College.
Yes, correct. In
And
a bachelor of Arts.
So a BA you had.
Yes.
And then what type of degree did you get from Yale?
A master's in nursing.
Interesting. Okay.
Not a master's in science on nursing.
But it was a
master's
definite
in
master's in
nursing.
nursing.
Yes.
So it was a post, it was almost a post degree.
Yale's idea was to make it more like medical education, so that you got a master's in nursing and the physician got a doctorate in medicine.
So that was fairly progressive of them at the time.
Very progressive at that time. Yeah.
So of all the changes that you've seen over time, what do you consider the single most important change to have helped nursing?
Probably the 70 definition of nursing practice. Now, the licensing law in New York State, I probably would have said that if I had been born earlier, but that was already in effect when I was born in 1931. That first Nurse Practice Act was signed in 1903, I believe. But in my lifetime, the definition of nursing for its final revision, which exists today, which is the one we practice under today, was in 1970. And it really set nursing forth as an independent practitioner. It described the practice of nursing as it should be described, to diagnose or treat actual potential health problems, etc. And then it said, and execute medical regimens prescribed by a physician. So that and really separated the independent practice of nursing, which was independent totally, which
Right.
could be done by herself, and then the collaborative part with medicine. So I think that was the biggest change and the most progressive change in my time.
Definitely.
Now, the other big change was the decline of diploma education, which happened when Medicare came into effect, Medicare and Medicaid, there was monies from the federal government to support diploma education, and then it faded away. So hospitals were encouraged financially to drop their diploma programs. Up to that time, all nursing education had been diploma education. That is apprenticeship education,
Right.
where they got no college credit. And they serviced the hospital. Matter of fact, it was interesting because you go into a hospital, all you saw were their homegrown nurses. When I went to Strong, all you saw were the Strong mortarboard caps.
Oh.
And when you went to Highland Hospital, you saw that nursing cap all over the hospital. You didn't see any outsiders in there. They were all very, very ingrown.
Born and bred.
Born and bred. And that's how hospitals staff their hospitals.
Did they staff their hospitals mostly with the students?
With the students.
So the students, even though they weren't getting paid, were
Slave labor.
slave labor, yes, slave labor.
Matter of fact, they paid to be students. So,
Right.
in a sense, they were paid to work.
They're paying to be slaves.
That's right,
Yeah.
paid to be
Oh,
slaves.
nice.
Yeah. And
How
that's
far
what,
we've come.
how far we have come, that's exactly right. So now we have very few diploma nurses. We have one left, I guess, in New York State. There were several in Pennsylvania and around other countries or states, but mostly they're gone by the wayside.
Do you remember the rate of pay when you first started?
When I first started, I was earning, I think, around $3,000 a year, and it was a 44-hour week. So you only had a day and a half off a week.
That's significant.
Mm-hmm.
And were you able to live on would a nurse, if she wasn't married, would she be able to live on her own at that rate?
Sure. Well, remember, a loaf of bread was, 10 cents or something, and everything's relative.
Right.
So the cost of living, get an apartment for $60 a month or something. So things were, so you could live on that. Well, sure, we did live on that.
They did live on that.
Yeah.
Right. Okay.
You weren't wealthy,
Right.
but you could live on it.
Was it, did you see a lot of private duty nursing back in that time?
Yes, you did. See a lot of private duty nursing. Matter of fact, I did some private duty nursing as an extra job to earn more money. Mm-hmm. Yeah, and you don't see that much anymore either.
No, you don't see a lot
This
of
is private duty in the hospital I'm talking
Right.
about. Mm-hmm.
That was big. I think in different areas of the country that private duty nursing within institutions is different. I mean, down in New York City at some of the wealthier hospitals, that was significant, even in the 80s.
Yeah. And sometimes when there were private duty nurses to work, they would ask staff, sometimes they wanted to PRN to work extra, to special a patient who needed one-on-one care. Those were the days before intensive care units. So you had very sick people spread around the hospital.
Okay. What do you think has hindered the progress of nursing as a profession?
Well, one big thing is that we're mostly women. That's one that relates to another question I think coming up. But another the biggest hindrance has been society's attitude toward women, which is the same issue, but then the lack of standardization of nursing education. In other words, there were 3 ways you could become a nurse.
Right.
Diploma education, which we talked about, associate degree education, which came in the 50s, and then baccalaureate education. And they all sat for the same licensing exam. So when you think of every other profession, think of every other group you can think of, they have a standardized requirement for their educational entry. Medicine, law, anything.
Right.
The ministry. Anything you think of, there's a known body of knowledge that they require, that they see as necessary to enter that profession. And in nursing, we just have not done that. We've not been able to. I think part of it is the fact that people don't see nursing, many people yet do not see nursing as truly an independent professional group.
Right.
They see us as helpers to the doctor. We only do what we're told. We don't think for ourselves. So they really don't have any appreciation until they get sick and they need nursing care. Then they find out
How important they are.
how important they are and how independent they are.
What do you think the impact of the women's liberation movement has had on nursing?
Well, as I said, I think one of our problems in nursing is that we were primarily a female profession. And so the women's liberation movement has helped us a great deal because it has helped society to see that people are equal whether they're male or female. And they both have brains and they can both operate and think and,
Yes.
and work outside the home and whatever else. So that was, I think, has been a big help to nursing, and probably social workers who are mostly female, and maybe school teachers. So I think it's helped all the professions that are seen as primarily female.
So when you were growing up, women usually went into either education or nursing.
That's correct. Or they got married and raised children.
So you had said that in the 50s is when the 2-year associate programs emerged. And what was the catalyst to that?
The catalyst was a shortage. There's periodic shortages of medical help, of physician care. periodic shortage that goes up and down. And it happened to be a period of time when there was a severe shortage of physicians. And Mildred Montag was in doctoral studies at the time in New York City. And she did a doctoral dissertation to show that nurses could be trained in 2 years at a community college. And so the federal government jumped on that doctoral thesis of hers and said, boy, oh boy, this is good. We can supply nurses in 2 years and solve the healthcare shortage. And so, and of course, community colleges were happy to do it because they wanted the money, federal money and support. They wanted the federal money. They thought it was a great thing. And nursing didn't put up much of a fight. First of all, we wanted nurses in the mainstream of education. We wanted diploma schools out of the way. We knew that was a bad thing. So it was sort of a mixed bag that I think from nursing's point of view, they thought it was good that nurses were now seen as in college, and that education would improve that way. But on the other hand, we should have made an effort to change the licensing exam, because Mildred Montag's idea was she didn't call them professional nurses; she called them nurse technicians.
Oh.
And so that was, but the federal government, which is very egalitarian, everybody has to be the same.
Right.
So they did use the same licensing exam, which we should have fought off at the time. But it happened very fast.
So in her study, in her dissertation, it basically said that, I guess I'm a little confused. In the study, did it say that they should be a bedside nurse, or that they should be able to work across the span of nursing? I don't
remember that there's any discussion about differentiation of the practice. Just that, I think it was basic nursing. I think she was talking about basic nursing, all the skills in basic nursing.
Okay.
I don't think there's any discussion about community health or any specialty areas.
Okay.
And I'm not too sure we were doing a lot of public health at the time, but I don't think. See, there weren't many people then who were prepared at the bachelor's level. Mostly they were diploma nurses. So I don't think it was. I don't think it was thought that far at the time.
Were there any programs in the country that were a baccalaureate level?
Yes. Oh yes. There were programs that were baccalaureate programs. University of Rochester was one, but that was a mixed bag. They had a diploma program and a bachelor's program all mixed up. But there were other ones all around the country, in New York City and all around the country. But it wasn't the predominant route for nurses. Okay. And some of them were 2 years and 2 years, 2 years of college and then 2 years of some program which was like a diploma program.
Okay. So my next question was, how have you noticed the nursing education has changed over time?
Well, now we are moved into we're moved into the mainstream of education. We are either associate degree educated or baccalaureate degree educated. There are very, very few diploma schools around. And the American Nurses Association came out in 1965 with this famous position paper that would ask that all nurses be prepared to the baccalaureate level. And we've been working toward that ever since. So 1965, that's a long time.
That is a long time.
Before that, a person named Brown, who was a sociologist, wrote a book, Future Nursing. That was in the 30s, I believe, 30s or 40s. And her observation in studying nursing was that they should be educated in a college, too. So that was the beginning of the whole movement. But we're still working that way.
We're still working
that way. You have to fight. You have to understand the opposition. The opposition is very strong. People have very vested interest. So the opposition one is physicians who don't want the nurses too smart. They don't want it. They don't want competition. It's the same problem with the nurse practitioner.
Right.
Same issue. But they don't want the nurses too smart. And then there's the hospitals at the time who had diploma programs didn't want to lose control over their staff and their staffing.
Right.
And then you have the associate degree programs who came along, and they don't want to now give up their their money that they get for educating all these nurses, because it is publicly supported, associate degree programs.
Right.
Taxpayer supported as well as student support.
Because in the state of New York, there are two-year programs through community colleges.
That's right. That's
Now,
right.
are there any two-year programs that would not be associated with,
Not that I'm aware of. Not that I'm aware of.
not associated with the state colleges? Okay.
Yeah. So there's a lot of opposition. And then you have people like the insurance industry that wants to be careful that nurses aren't so well educated they're going to ask for more money. And that scares them. They don't want to have to pay more money for nursing care. So there's a lot of opposition to keep nurses down.
We've always known that nursing reimbursement has always been through the room fee.
That's
within
right.
any hospital institution. And it's been a nemesis of ours in many ways.
Well, while I was president of while I was director of the legislative program of NYSNA, we got a piece of legislation about reimbursement for nurses through the legislator and signed by the governor. But it was a make available law. In other words, the client has to ask specifically for nursing coverage. And then it's available. They have to make it available. But most people don't know that. And the insurance company is in the position to ask whatever payment they want for that insurance coverage.
So explain that a little more. I'm a little
Okay.
confused on that.
Well, let's look at the other insurance. When you buy an insurance policy that covers maternity or whatever, you know that when you go in the hospital and you have a baby, you're going to be covered. The insurance company is going to pay a certain amount. That's a given part of your contract. But this make available contract means that it's not, you're not qualified for payment of nursing services unless you specifically ask for it. Ask your insurance company, tell them that you want that coverage. Then, by law, they have to provide that for you. But it doesn't say anything in law about how much they can charge you.
Okay.
So they might make it prohibitively expensive.
So what year did you help get that legislation through?
Yes, I certainly did.
So that brings us to your NYSNA years.
Yes.
And what year did you begin in the NYSNA?
My NYSNA years were going for a long time because I started as president of District 2, which is in Rochester area. And as president, you go to certain meetings in Albany and meet with other districts around the state and the leaders of NYSNA. So you're involved in some of the decision making from that point of view. So that was my introduction. And from there, I got appointed to various committees and whatnot. And then eventually they asked me to run for treasurer of NYSNA, which I did. So
now, was that at the local or the state level?
NYSNA is a state level.
At the state level?
Yeah.
And what year did you approximately begin in there? Just to sort of give a timeline.
It was in the late 60s.
Okay. So about 40 years ago.
Because I was president in the 70s, early 70s I was president. So it had to be late 60s. And so I was there when Governor Rockefeller signed our famous 72 Nurse Practice Act into law. And I sat on some of those workshop committees to develop that law, which was very, very interesting.
Can you explain what the 1972 Nurse Practice Law was? Act, excuse me.
What it is? That's what I said. It defined nursing clearly.
You did
it
say
gave
that.
a definition of nursing, and
Yes.
it outlined the independent practice for nurses.
Okay.
The licensing laws before that time merely said nurses keep track of what patients do. They write it down and they report to the physician. That's about it. They were very not helpful to the nursing profession. And so the 72 definition was very, very important.
Okay. My next question, and I basically have asked this, but I just sort of kind of want to sum it up, is your years as a NYSNA lobbyist regarding your fight to get the first proposed legislation to change the entry into practice to BS.
That's very, very interesting. Yes, we had the 1985 proposal, which was to which was started before 1985, actually, gave ourselves a 10-year lead time there to make this law come true. And we tried to rally all the nurses in the state to understand why it was important to standardize nursing education. That's how we approached it, standardization of nursing education. And we showed what all the other professions did for their education and showed that nursing was the odd man out in terms of educational requirements. And that this kept us back. It kept us back financially. It kept us back in terms of movement, progression, wherever you want to, advancement, if you want to say it that way. So it was very important for nursing if they wanted to establish itself. If nursing wanted to establish itself as a true profession, it had to have a standardized nursing education base. And so trying to sell that is like trying to sell snow to Eskimos. Because the nurses, again, looked, like all humans do, looked introspectively, and they said, but I'm a diploma nurse and I'm as good as any college-educated nurse.
Right.
And the docs, of course, the same doctors I talked about, I shouldn't say doctors, I should say the medical society. The organized medicine was the one that presented the opposition to us, not the average doctor. It's the organized medicine that opposed the advancement of nursing for its own reasons. And the insurance companies, I said, for their own reasons, because they didn't want us to earn more money, to make more money, and then have to be reimbursed more money. So there were, and the Hospital Association was opposed to all that. The Hospital Association of New York was opposed to it because, again, they didn't want nurses to earn more money, because that would be more money for the hospitals to pay out, so they were against it. And besides, they liked keeping nurses contained. So all of this was a containment sort of an effort by outside groups. Right. And the worst part was that nurses were not all together. Nurses themselves, I would say, are the cause, because the legislators would say, yeah, but my constituents don't agree with you. My constituents are nurses, and I have a diploma school in my town, and they think they don't need this education.
So as a collaborating group, nurses have worked against themselves.
So nurses worked against themselves, that's right. They worked against it because they didn't understand it, no matter how hard you tried. And even though you had grandfathering, you grandfather everybody who was currently licensed, because you can't take a license away from anybody.
Right.
And so all that still didn't matter to them.
Okay. Just a little, let's talk about the impact of unions on legislation.
Unions are another interesting thing. The American Nurses, the New York State Nurses Association got involved in collective bargaining back in maybe the 50s, 60s. And at that time, collective bargaining was very strong all over the country, and nurses were the labor unions were looking at new groups to organize, and they looked at nurses. They thought this would be a good group to organize, and so the AFL-CIO and all these groups wanted to grab the nurses. Mm-hmm. And so the profession, NYSNA, looking at it, said, we don't want our nurses to go and join AFL-CIO. Then they won't be members in their professional association. We'll lose them all. So we want to keep the nurses in a professional state of mind and professional place. So the New York State Nurses Association decided they should become a collective bargaining unit themselves, agency themselves. So they went through that routine you have to do, and they became an official bargaining agent. And what they sold the nurses, which was good and right on, was that we will only collectively bargain for professional nurses. Nobody else. No housekeepers, no anybody else. Just nurses. And we know what your needs are. We'll listen to your arguments, and we will fight for those. So it was a very closed group. Mm-hmm. And so it started in New York City, which is mostly all organized now, the Health and Hospitals Corporation of New York City, which is a great group of hospitals. And they've been organized with NYSNA now for years and years and years. But now it's, Unions have gotten, I guess they've lost some of their members over the years, some of their groups that they organized, and they're looking for more and more members. Unions are hurting.
Right.
So they want members. And so there's a battle going on now with the nursing. I think whether or not NYSNO will lose these people or not, I don't know. But it's a serious problem now. Unions have, it's sort of gone off too far. And I think nursing is going to lose for it.
Were you implemental or a part of the Taylor Law where nurses cannot strike? I mean, they can strike,
part of the law,
but they can't.
Yeah, well, according to the licensing law, New York State licensing law, you cannot abandon your patient. Otherwise, you'd lose your license. So the NYSNA got around that by saying, these are the rules. You can strike, but this is what you have to do. You have to leave enough nurses behind to take care of the patients, and the rest of you can go out and walk the picket line. And that's how you do it. But you can't just all walk off the hospital.
Now, is that part of the Taylor Law, Taylor Act?
No. I don't think there's anything there about what the limitations are for striking. It just says you can strike. So the profession said that, but the profession is controlled by the New York State Education Department.
Right.
And that's in the conduct code of New York State. If you abandon your patient, you're sunk.
And rightly so.
And rightly so.
Yes.
Right.
Do no harm.
Do no harm, that's right.
Yes. Okay. Well, let's step aside from all of that heavy stuff for a minute and talk about who do you think is your greatest nursing role model?
Well, I was thinking about that, and you can't help but say Florence Nightingale. You can't help but say that, because at the time that, it always amazes me to think about that woman and the time that she lived in the 1800s, mid-1800s, and to think that at that time women could not work. They could not own anything. The only way they had to survive was to get married or become a prostitute or live in somebody's house and take care of their kids or something like that. They could not work. And so this woman did it. She just went out and did it. Learned to be a nurse. She went to Germany to learn that, and then she went to Crimea, and she kept all these records, and fortunately she came from a wealthy family, and she was well educated, so she had the smarts to figure out how to do this. And but to think of doing it at that time period just blows your mind. It's just staggering to think about the strength that woman had. So you can't help but say that she has to be one of your role models. And then the other people that appeal to me are Dorothea Dix, who took up the fight for the mentally ill, the people who were chained in the basements of places and who were sent to prisons because they were not mentally well. And then she took this fight all over the country and established the state hospital system, essentially. And so you think about people like that who had the courage and the guts to do that, and I can't see, there are not many people that I see today who could do that. The most modern person who I admire a great deal is Veronica Driscoll, and she was the one who was the one behind the 1972 Nurse Practice Act. She was a very, very brilliant person who was executive director of NYSNA when I first started there. She since has passed on, but she wrote this book which really describes the problems involved in passing legislation to do what she did. This was her doctoral dissertation, and she gave the preface to the foundation. And it's a wonderful little book. It's an evening's read, and I really recommend. I put it in the library some time ago in the Keuka College Library some years ago. But it's a wonderful book for people to read if they want to know about the legislative process and all the battles that are involved in getting a bill into law.
Right.
And read that little book.
Could be something that we're going to implement into another course. Good. Well, let's talk about the foundation. How did that even come into being?
It came into being because when Veronica was executive director, she saw there were things that the NYSNA, the Professional Organization of Nurses, could not accomplish. And she saw the need for a foundation, a independent foundation of nurses in New York State who could do three things as she saw it. One was, and she divided them into centers, into three centers. The Center for Nursing Research, which would keep track of all the nursing research going on in the state by nurses, and advocate for nursing research and support it in some way. Maybe get grants and whatever. So that's a Center for Nursing Research. Then the Center for Nursing History, which is another important thing. She wanted to have some way to document and keep track and record and save the history of nursing in New York State. So that was the second one. And the third one, which was very obvious, and as we've talked, it must be obvious, that society doesn't know much about nursing. So the third was the education of the public about nursing and what it does. And so those are the three centers. And it's things that the professional organization just did not have the time or energy to do. And so she established this foundation, and I was one of the founding trustees. And we picked out the site and built a building, collected money to build a building. It's a beautiful building. And it's a very active organization now. We still need money, but it's an active organization.
Always. Yes. Your perspective on the progression of the intercollaboration and interprofessional development between MDs, NPs, and nurses.
Well, if you look back a few years, many years, doctors were, and still many of them see themselves as the Lord and Master of healthcare. And in the early days, nurses stood when the doctor came in the room, in the doctor's office, in the nurse's station in the hospital. You stood, and when the doctor walked in. And you didn't salute, but just about.
Right. Mm-hmm. I remember those days, yes.
You remember those days, right. And so it has changed. It has changed. And I noticed it with young men coming into medical school who came in with a different attitude toward women and nurses than the older people. And I think it's part of women's liberation, the part of, I don't know, the movement in society to accept people alike, that men and women are not, one's not inferior to the other, in other words.
Right.
That they're equal footing. They're both human beings, and both have two arms and two legs, and so what's the big difference? And so that attitude in the young people coming forward in medical school, I think, has been obvious. So that today you have young men practicing medicine who see nurses as a colleague. And that's another reason why now nurses have to come up to the plate. Mm-hmm. Because if they had an education which made them feel as if they could talk to a physician equally, then it would just be a natural growth, mm-hmm. a natural relationship. But many nurses still see themselves as inferior and lesser than men. They really do.
They do.
And so that's a problem. But I think it's certainly much less than it used to be. And now that women are equal pay for equal work. When I first was a staff nurse, I remember, this was the late 50s, the male attendants earned more money than the female attendants. So there was actually discrimination in pay. They did the same work, everything else, but they got different, because it was a man, he got more money. So that's all gone by the wayside, which is good.
Yes.
So I think the fact that in society the two sexes are seen more even impacts on nurses and physicians, their relationship. Now, nurse practitioners gets a little trickier. Nurse practitioners gets a little trickier because they are verging closer to the practice of medicine. Although, and it started out that way, which is another thing the federal government did, which was wrong. They jumped on the nurse practitioner movement to solve the same problem they tried to solve with the associate degree nurses educated.
Right.
They wanted to solve the physician shortage at that time. And Loretta Ford's idea started out pure and simple in Denver, where she wanted to take master's prepared community health nurses and prepare them with diagnostic techniques, examination techniques, assessment techniques that would help them in their practice in public health nursing. And it proved to be her study proved to be very effective. She worked with a physician there, a pediatrician I think he was, because she was a pediatric nurse practitioner. And they established this study, which was very successful. Well, again, the federal government thought that was a terrific plan. And the federal government, again, being egalitarian again, did not like this idea about only accepting master's prepared nurses. No way. Any nurse, any person with an RN could qualify for these certificate programs which are set up in hospitals for nurse practitioners. So Strong Memorial Hospital set up their certificate program with Joan Lionel and Barbara Bates. And the people who applied could be any nurses. And I was a director of nursing at Highland then, and at least 2 of my staff nurses applied. Both of them hated nursing. Both of them, one would never wear a uniform. She always wore a lab coat because she didn't want to be a nurse. And the other one wanted to be a doctor. So you had these people going into the nurse practitioner certificate programs who should not have gone into them because it steered in the wrong direction. And so the movement started out with them being intern substitutes. The hospitals encouraged it because they liked the nurses to come back and relieve some of the stress on the interns, medical interns. So intern substitutes. And so those of us in the nursing organization were very, very distressed with this movement that it was going in. And so we were seen as being opposed to nurse practitioners. We were not opposed to the idea of nurses knowing diagnostic techniques or doing more things. We were opposed to people thinking they were junior doctors. They were nurses who just happened to know how to examine somebody.
Right.
So this was another philosophy which was hard to get across. Fortunately, the American Nurses Association came in sometime later and set the standard for a master's degree for nurse practitioners, and that helped a great deal. And the emphasis, I think, has been pushing the nursing idea of a nurse with just more technical skills.
Okay. Very good. Well, I'd like to thank you for your time.
You're very welcome.
Next, maybe the next time we get together, we can talk about the Institute of Medicine and their recent report. But thank you, Janet.
You're very welcome. I enjoyed it.
Good.